This week right here, we told you exposure to deer ticks this time of year is particularly dangerous. That's because of what you see right there, those tiny ticks known as nymphs. They cause most cases of Lyme disease and they're very active. According to the CDC, kids are most at risk for tick-borne illness because they are less likely to notice a tick bite and often play in areas where ticks are more active. But there are a number of things you can do to keep your kids safe this season. News Center Maine's Vivian Lee shows us how.
Jenny Burnell's 11-year-old daughter Hadley and her best friend Lila love playing outdoors. That includes romping around in the grass with the family's new puppy, Casco.
Good boy. Hey, Mama.
When the girls head inside, Jenny immediately checks for ticks that carry tick-borne illnesses, especially young deer ticks or nymphs, which are the size of poppy seeds.
A quick check of their hair, kind of hidden spots in the socks, in the shoes, behind the ears. And at night, just daily tubs or showers.
Dr. Christy Perkowski is a pediatrician at Northern Light Mercy Dr. Harry E. Davis Pediatric Center. She says daily tick checks are the first line of defense against Lyme and other diseases. But what if you find an embedded tick? She says remove it immediately using fine-tipped tweezers and determine what kind of tick it is. Your child's provider will also want to know how long the tick may have been attached.
The longer a tick has been attached, the greater the risk that it could transmit Lyme. And so making that determination with your doctor is important.
Dr. Perkowski recommends treatment within 72 hours of removing a tick with a single dose of oral antibiotics. She also advises to be on the lookout for other symptoms. The most common in children is a rash that presents differently than a classic bullseye.
A red, expanding rash that's usually not itchy or bothering them in any way, that's usually at the site of the tick bite, but could appear in other places as well.
Now, some patients never get a rash but can have flu-like symptoms and joint pain. With treatment, experts say most children recover from Lyme disease within 6 months of diagnosis. Jenny's dad was diagnosed with Lyme 6 years ago and still has lingering symptoms.
I don't want to see my kids suffer like he did. And I think, we just have to be diligent because they're not going away.
Keeping her kids safe from being exposed to a disease that is hit so close to home. In Cumberland, Vivian Lee, News Center, Maine.
We will have much more on treatment and prevention of Lyme and other tick-borne infections in the News Center Maine app.